thank you for joining us today. I am Mary Jeter, your host, and Harriet Carter is my co-host. And today we have a panelist that is just phenomenal. We have Dr. Boulder, we have Stacy J. Reed, Dr. Thompson, and Dr. Smith. But I wanted to discuss with you today why we are here. We are here because of alopecia. This is a safe community. And what I want to explain when I say safe, when you've been diagnosed with alopecia, you have a newfound look on life. And first I want to start with why I started this program. I am the founder of Chat to Do Empowerment Women Group and the host for 50 and Unfiltered. In 2020, I was diagnosed with scarring alopecia. And that took a tremendous toll on my life. I didn't know what to do or how I was going to go on without having my hair. And in our community, our culture, that is our crown. For a woman, that is the one thing that you adore and you want to make sure you look good. I spent a lot of time in depression. I spent a lot of time thinking, I'm not going to lose my hair, pretty much in denial. And it wasn't until later on that I said, this doesn't make me. I went through a lot of stages of grief, not knowing if I was going to be accepted amongst my friends and my sisters. I didn't know how to deal with it, but I really took the time to learn about alopecia and scarring alopecia. So having said that, I would like to tell you that you have hope. You have a community here that will take time out and help you get through this process. I didn't want to experience it alone, and I didn't, and I have a very good support system. And they stood beside me, and I am here to help you do the same thing. A lot of people don't know what alopecia is, so I'm going to start with Dr. Boulder today. Will you please tell us exactly what alopecia is?
Yes. So alopecia is the medical term for hair loss. Anytime you're losing hair from the root, then it is a type of alopecia. There are two categories or classifications of alopecia. We have non-scarring or non-cicatricial alopecia. This is where the hair follicle gradually shrinks, but there's hope because we can get that hair to regrow. This is hair loss like female pattern hair loss or hair loss due to medications or hormones or nutrition. And then there is scarring alopecia, also known as cicatricial alopecia. This is a more inflammatory type of hair loss or alopecia where your immune system is coming in and fighting off your hair follicles. Basically, it's creating lots of inflammation around your hair follicles. This leads to destruction of your hair follicles, and that hair follicle is replaced with scar tissue. Once you have scar tissue and destruction of the hair follicle, we are not able to get that hair to regrow. There are a couple of different types of scarring alopecia. CCCA, or central centrifugal cicatricial alopecia, lichen planopilaris, or LPP. Sometimes discoid lupus can cause the scarring alopecia, or folliculitis decalvans, or dissecting cellulitis, or other types of scarring alopecia.
What would you say is the most common among African Americans, especially women?
When we look at African Americans, the most common non-scarring type of alopecia is going to be female pattern hair loss, which is hormonal hair loss, most commonly seen after menopause. The more concerning type of hair loss in African Americans is going to be CCCA, or central centrifugal cicatricial alopecia. It's more concerning because it is a scarring form of hair loss, and so it needs to be detected and treated early in order to prevent more hair loss and more complications down the road.
What are some of the symptoms to help us identify that for a treatment to actually go into the doctor?
So some of the first signs and symptoms that you may notice of alopecia: itchiness, burning, tingling, stinging sensation, tenderness of the scalp. It may be different. It's usually persistent. It doesn't fluctuate. It doesn't come and go. It's itchiness, tingling, tenderness that's persistent or constant. You may notice itchiness or, redness of your scalp. Sometimes you can get hair bumps or folliculitis, inflammation right around the hair follicles. Those are the more common signs that you may see early on. Later, you may see more shininess to your scalp or areas of complete hair loss.
When you say shininess of the scalp, kind of describe that, because a lot of people can kind of get that confused with something else. The shininess is the scarring tissue, am I correct?
You are exactly right. So once you feel a smooth, shiny, or waxy appearance to the scalp, that usually means that hair follicle is gone and that hair cannot regrow.
What is the treatment then for that?
So the treatment of alopecia is dependent on the type of alopecia that you have. If we look specifically at CCCA, treatment starts with early disease. We're using mainly anti-inflammatory medicines. These are medicines known as topical steroid medications. These are medicines that are meant to calm down the inflammation that's targeting the hair follicles. For more advanced or moderate to severe disease, you may need to have intralesional injections of steroids. These are shots that are performed directly into the scalp. And then for even more severe or more advanced disease, you may need oral medicines or systemic medicines that help to calm down inflammation in the skin and in the scalp. These are sometimes antibiotics or other stronger, more potent autoimmune or anti-inflammatory medications.
Okay, guys, I want y'all to feel very comfortable to jump in and ask questions at any given point in time. This is about you getting the answers, or helping you get some of the answers that you need that would help you walk through this journey. This is a journey. And Dr. Bowler brought up a very good point about inflammation. Dr. Smith, can you tell us from your internal medicine aspect how we could better help ourselves deal with inflammation?
To think about the inflammation, in which that I'll lead into that. But I think the most important thing is for people to start accepting that hair loss as potentially a sign of a medical condition. And the earlier you treat, the more likely we can help you, and maybe we can get you referred early. And also just to identify what's not normal. Just like when I think about the itching and the burning and the soreness, I think about what we learned when we're very young with our hair culturally. We experience the itching, the pain, depending on what we're doing, whether we have tight braids in our hair, whether we have beads in our hair, whether we are burned from relaxers, and other chemicals or color that we're putting in our hair. And that causes inflammation. Even tight braids. And I know sometimes people just accept, I know I'm going to have pain after I get my braids for at least a couple weeks, maybe. Or if the scalp is itching, and I know I see it all the time, depending on the hairstyle that some of even, my family, friends, patients have, they're hitting their head. Like, well, what are you doing? And I know I asked that a long time ago. And it's like, it's itchy or sore or whatever. And instead of messing with the weave or the braids, they're hitting their head. That's not normal. You should not have those symptoms. And so those symptoms should be a trigger. Young girls who have hair loss around the front line because of the tight ponytails or braids. Sometimes, and we see it a lot, it's what's accepted as, is from whatever. Or so at an early age, people experience hair loss and don't realize that they're damaging the follicle. So I think that's the first thing, early diagnosis and coming in. And I know a lot of people wear weaves and wigs and extension, whatever is like an accessory. It's a fashion accessory. And so when people come in for their physical, we're not going to say, take off your wig or whatever, or let me look at it. And so because it's sometimes it can be humiliating, and people may not be ready to talk about it, or they may feel embarrassed of the amount of hair loss. But your hair, your skin, your scalp is part of your medical health, part of the physical. And so depending on, some people, when it reaches a point, the most important thing from an internal medicine standpoint is to get the history of the timing and what was going on. Because I also use a lot of medications that can cause hair loss. And so oftentimes when patients come in, getting that history and the accuracy of the timing and the family history and the medicines, and when you started the medicines, and if you've been sick, have you recently been pregnant? Do you have a history of PCOS? What's the hair care routine? Have you had a stress or a trauma? What is your diet? It's all these things, and it's very complicated, and people need support. You need support to understand this is part of your health, and there may be help, hopefully, if you haven't waited too long. So that inflammation from all these things, it can be just complicated, can be overwhelming. And so I just think the support is very important. It can be a sign of internal disease. It tells us a lot. So I hope that answered your question.
Yes, you answered my question.
I was going to ask you, Dr. Smith, I know you said that different conditions. Can you tell us, are there any general or specific conditions that alopecia is linked to?
Well, there's definitely...
And commonly in women like us?
Yes, and Dr. Boulder had mentioned, some of that lupus. We think about sarcoidosis. And of course, if someone has infection, it can be ringworm. It can be the cellulitis, which can be from different types of infection. A folliculitis. It can be from, and folliculitis is general, right? And I know I come from a family of a lot of barbers and beauticians, and cleanliness and sterilization is so important. And one of the things that I learned early is that sometimes if people are using things that have not been sterilized and you're cutting, people can develop a folliculitis from it. So infection, is one thing to think about also, but those are the things that if someone comes in and they're saying, I'm having hair loss, these are all the things that, I'm trying to work through. And either we need additional blood work, we need additional information, or we need to change up some things. So definitely the other thing that's very common, we think about high blood pressure. So high blood pressure is prevalent in our community, and some of the most common medications that we use can cause hair loss, including ACE inhibitors. And some people know as lisinopril is a common one. Excellent blood pressure, helps with preventing heart failure. It helps protect your kidneys. It is an excellent blood pressure medicine, and it has a lot of different benefits, but it can cause hair loss. In some people, just because you're on it doesn't mean you're going to have hair loss. Beta blockers are another one. Beta blockers that help treat high blood pressure, but has side effects. One is hair loss, but yes, it helps people live longer. We use it, people who have heart failure. And so there's also a priority. And then there's a lot of variation from no hair loss that could cause hair loss. So thinking about the common diseases in African Americans, and the high blood pressure is a big one. And the medicines that we use can commonly contribute to the hair loss. So one of the first things is looking at the medication list.
Oh, wow. So you've taken into medication lists. I want to piggyback off something that you made a statement earlier. We talked about a biopsy and being performed, and then you also stated, Dr. Bowler, you also stated that it might not be necessary because of the scarring tissue. Please tell us a little bit more about that.
Yeah. Well, let's first talk about what a biopsy is. So a biopsy is where we take a small sample of the scalp or the hair-bearing area to look at it under the microscope. So we send that specimen off to a lab and have a pathologist take a look at that. It's a procedure where we give you a little numbing shot of lidocaine. That's a shot like you get at the dentist office. And then we take a usually 3 to 4 millimeters, so a very small sample of the scalp, a little plug of skin, and then we put you one stitch in to close that area. A biopsy can be very helpful, especially early on in the disease process. It can help to tell us if there's areas of inflammation or if it's a non-inflammatory type of hair loss, meaning a non-scarring type of hair loss. It can tell us if there's the type of cells that are present. The type of cell may indicate the type of alopecia that you have, and then it can tell us if there's scarring present. If you have more advanced disease, a biopsy may not be necessary because we can just assess it based on our clinical observation. Just looking at the scalp, we can see areas of scarring. But in early disease, in early diagnosis, a biopsy can be very helpful in distinguishing the diagnosis.
Is it an autoimmune deficiency?
As far as scarring alopecias, so the reason why you get scarring alopecias most of the time are due to your immune system. Your immune system, whether it's you have an infection like folliculitis, like Dr. Smith said, if you have a bacteria there, your immune system comes in and fights off that bacteria or that fungus, and that can cause that follicle to be destroyed. You can also get autoinflammatory or autoimmune processes where your immune system is coming in for no good reason at all and attacking those hair follicles. That immune system can cause scarring or sometimes non-scarring in the case of alopecia areata.
How do you treat alopecia? And I know it's different forms. So I'm just curious, when you are at the various stages, how is treatment?
Yeah. So it depends on the type of hair loss that you have. If you have a non-scarring alopecia, you're looking to see if there's any potential cause to the hair loss. So if it's due to a medication, you're taking that medication away. If it's due to poor nutrition or due to stress, you're trying to remove those potential triggers. If it's due to hormones, you may be trying to block specific hormones. When you're looking at scarring alopecias specifically, it's going to be more difficult to treat. You're using anti-inflammatory medications. First, you're starting with topical steroid or topical anti-inflammatories. Those are going to be either liquids, gels, ointments, oils that you can apply to the scalp to help to target this inflammation. For more moderate to severe disease, you may be getting injectable steroid shots. These are shots directly into the scalp. And then even for more severe disease, you're looking at anti-inflammatory pills. These are going to be medicines like doxycycline or minocycline, sometimes medicines like Plaquenil, which augments your immune system. And then there's minoxidil or Rogaine. That helps to stimulate hair to grow. So that works different from all the targets. It works to, one, improve circulation or blood flow to the scalp, and then two, it helps to prolong the growth cycle of your hair.
I want to piggyback on something else that Dr. Smith also stated, was that we have to have a more positive outreach about our mental health when we're going through our hair loss. Dr. Thompson, how can our mental health and getting mental health play a major role in our recovery and building our confidence back once we've been told that we have or been diagnosed with alopecia?
Definitely, mental health plays a big role because the loss of hair is a great loss and it impacts us. Oftentimes in society, we may not place the same value on loss of hair as we do on the loss of a person or loss of a job, but it is a loss and there's a grief process. Initially, patients may be feeling that they are in denial. I cannot believe that this is happening to me. Followed by some anger. Why is this happening to me? Life is not fair. What did I do to deserve this? And then we may begin bargaining. We may begin to say, if I could spend this amount of money to get my hair back, I would. If I could do this, I would. And then there's the depression that we go through, which is where we may feel worthless because we have tied our hair to our identity for so long. And so without that hair, that loss, we're grieving that. We're beginning to cry. We may even feel like we don't want to live anymore. We may feel ashamed in our community. And followed by acceptance, that's where we want to get to. We want to be able to accept this for what it is. We want to acknowledge our emotions that come along with this. It's okay to feel sad. It's okay to feel anxious. We're navigating a new arena here with this new condition, and we don't know everything about it today. But we can get the knowledge that we need. We can gather our resources, our support groups, our treatment options, and we can decide what's best for us. And we can allow ourselves to become resilient and face this hurdle and overcome it. So mental health is very, very important during this process of a loss.
I know for me, I actually started counseling and I actually started the process of I didn't want to, not so much didn't want to live. I just didn't know how to deal with it personally. I didn't know which way to turn. I didn't know if I was going to lose it all at one time. I didn't know if it was just going to shed overall. But I had to stop and actually started thinking about who am I, even without my hair or with my hair. It's not the outside appearance that makes this, it's the person on the inside. So after starting counseling, I had to start then developing, and it took me a moment. A lot of people didn't think they wanted to talk about, oh, you're going to counseling. Oh, something got to be wrong with her. And there's nothing wrong with seeking and talking to a counselor and getting mental health. I know from a standpoint how I want to know how we can pull more people in and make them feel more welcome. And I know that is a culture thing too. And having said that, can you give us some suggestions of being able to pull people in?
Definitely. As you said, we don't have to be in a crisis before we seek help. We can begin to seek help immediately because we will need some tools in our toolbox in order to navigate this new area that we are stepping into. You may be depressed, you may be anxious. There is strength and courage in seeking mental health treatment because we don't want to wait until we're in a crisis and at our lowest point to seek help. We want to seek help early so that we know how to cope effectively, so that we can gather those resources together, so that we can learn how to separate our physical appearance from our self-worth, because our condition and disease does not define who we are. Our physical appearance does not define our value. And so we can find ways to navigate this, whether through psychotherapy, medication. There are multiple ways. Representation is important. So find a provider that you feel comfortable talking with, a safe space that you can present your emotions and acknowledge what is happening so that you can partner with that provider to develop a unique treatment plan for you, because everyone's journey will look different. What happened and worked for one person may not work for the next. But just please allow yourself to be educated, do your research so that you can make the best decisions for you at the place you are in your journey.
I want to check and see if we have any questions. Anybody have raised their hand? And if we have some questions, then we will go take those questions now.
Is there a length of time between strand loss and permanent follicle damage?
It can depend on the type of hair loss and how long the process has been going on. So if you take traction alopecia, for instance, which Dr. Smith talked about earlier, that's where you have loss of hair along the frontal temporal line of your scalp. You can have the hair fall out and then it may regrow, but the recurrent nature of that tension, that pressure on those hairs may lead that hair to be permanently removed. There's not a specific timeline on that. There's nothing to say that that hair is going to fall out and regrow a few times and then it's going to be gone. And the same is true for CCCA. It's not a specific timeline that says the hair falls out and then it's going to not grow back. That's one of the main reasons why early intervention is important, so that we can help to treat early and prevent the hair loss.
Okay, everything that I'm hearing right now, it is early intervention. Please, please, please visit the dermatologist, and get your diagnosed, get it checked out, get some answers to your issues. Do we have another question?
As of now, that's all the questions for in the chat.
Thank you.
Dr. Smith, with conversations with your clients, how do you approach the conversations of health and weight when it comes from a inflammatory condition?
It is connected. So once again, someone comes in and they say, I have hair loss. From an internal medicine standpoint, primary care standpoint, and how we, especially when we do referrals, oftentimes there's an initial evaluation of, what is the cause? And like we mentioned before, there can be many different causes. But it starts with the history and when it started, family history, medications, and like I said before. So the better that communication is and better that kind of having that safe place and trust to discuss it. And also it requires evaluation. So look at the scalp. I look for that folliculitis or any type of rash or signs of inflammation. I look to see if there are actually follicles or is there absence of follicles. And that often tells me, oh, this may be scarring, it may be irreversible. And I know right away, whatever, I'm going to need to refer them to dermatology. So if I can't see anything specific that's like, okay, I'm not sure, which is very common. And of course, it is also common in menopause, as Dr. Boulder had mentioned before. But I make sure that I review the medicines and then do blood work. And so some of the blood work can also help guide, if there's an inflammatory process going on. So I check blood counts, I check thyroid, which can cause hair loss. Check your metabolic profile. What is your blood sugar? Is there any problems with the liver or the kidneys or the electrolytes are off? Sometimes hormonal. Does someone potentially have PCOS that hasn't been diagnosed? And that's just an example. Check inflammatory markers like SED rate, CRP, and those are more general. And they can be caused by a lot of different things. And that would have to be kind of worked through also. But sometimes it can give us a guide that, okay, this is abnormal and we need to move forward. And then determine if there's any other hormones that need to be checked. But whatever that cause is, just in general, if we think about inflammation, it is related to nutrition. Because what we put in our bodies can also help with inflammation, or the things that we put in our body, like a lot of processed foods, can contribute to the inflammation. So I always say if there's whatever that diagnosis is, and especially if inflammation is involved, we are one body. We're not separate compartments, and one thing can affect the other. So we need to do things to support our nutrition, because it's linked to our immune system. So in general, I talk about, because it can be complicated, and I have a little list here that I'll do quickly, but I tell people, eat the rainbow. When you look at your plate, it needs to be colorful like a rainbow, because those colors are anti-inflammatory things. And people like to buy things, right? Like, I'm going to buy this supplement with all these antioxidants. I'm going to buy this and buy that. Well, it's a big market. And you don't know, sometimes it's not regulated, it's a supplement. And I always tell people, why don't you find that in the food? Because I also know that that's going to help with your cardiovascular system, right? It may help with your diabetes. But just to give you an example of eating the rainbow, I have my list so I can just do it quickly and not take up too much time.
No, you're doing good because that was going to be my next question, like the health foods and the supplements, which you would advise,
so
to
I'm not
stay
a
away
big
from.
supplement. I'm not a big supplement person. I like to tell people to add certain foods because the American diet is brown or tan, meat, potatoes, not a lot of vegetables, not a lot of color. So that's what I mean about the eating the rainbow, right? So, so foods like, antioxidants. So when I say the vitamin is going to help with antioxidants, and I'm just going to list the foods that provide anti-inflammation, that we should have a lot of it in our diet, right? So vitamin A, carrots, sweet potatoes, pumpkins, squash, cantaloupe, kale, spinach, red peppers. Vitamin C, citrus fruits, strawberries, cantaloupe, broccoli, tomatoes, green and red peppers, kiwi, and sweet potatoes. Vitamin E, spinach, broccoli, green and leafy vegetables, papaya, mango. When we talk about things supporting the blood flow and circulation, which, even they say massage will help with circulation, may help support hair growth. So every time I wash my hair, I'm massaging my scalp. But things that help with circulation and production of red blood cells for circulation, folate, cooked spinach, asparagus, black-eyed peas, great northern beans, Brussels sprouts, iron, dark leafy green spinach, collards, artichokes, dried fruit, prunes, raisins, flavonoids, apples, onions, broccoli, berries. So I could go on. But eat the rainbow.
Eat the rainbow.
Eat the rainbow.
That's my take.
The new thing today is to eat the rainbow.
Eat the rainbow, and you can, you're going to have all these other health benefits. And also think about ultra processed foods are going to cause inflammation, but it's going to help the rest of your body also. And talking about cancer prevention and cardiovascular health, Mediterranean diet, you can get this information on the internet. Everything's on the internet, but you got to make sure you're looking in the right places. So nutrition is important.
Very good.
She's mentioned nutrition is important. I want to give another aspect to it. I'm going to jump subject just for a moment. I want to talk to Stacey J. Reed because you help other people feel a little more at ease when you start working with their hair loss. And how do a cranial prosthesis fit into this equation?
Well, I do what is called hair replacements, and that's replacing hair in the areas that they've lost hair, but it's non-surgical, so it's called a hair replacement. And it just depends on their lifestyle and how much hair they've lost. It depends. That's how we determine what kind of.
So basically, they come in and you actually make this unit, the system for them?
No, these are ordered.
Oh, they're ordered. Okay. So I'm telling you, I know for a fact when dealing with that and you want to feel confident and you want to go that route, there are others that have chosen just to actually cut all of their hair off and instead of having a unit. Dr. Boulder, I can remember a person asking a question a while back, not with this program, by cutting all of the hair off, will that eliminate, or not necessarily eliminate, but reduce some of that inflammation?
Not necessarily, because the inflammation is at the root or the bulb of the hair, and so that's actually in the skin. And so even if you cut the hair very close to the scalp, you still have that inflammation that's in the skin that can still be active and can still be attacking those follicles.
I remember actually lacking knowledge. I decided I was going to cut all of my hair off. And I actually visited the doctor, and the doctor gave me that same information. And I'm glad now that I didn't, because I would still be dealing with some of the same issues. Dr. Smith, you stated a very good thing about vitamin. We do have another question in the chat. Ms. Morgan, will you please ask that question again?
Yes, the question was, are hair vitamins helpful with CCCA? And she mentioned that the question was actually already answered because Dr. Lori basically gave a really good explanation of the vitamins that were needed.
Basically, it was dealing with, go ahead, Dr. Smith.
So I certainly, because some people think more is always better. But when people start getting things over the counter, I do recommend make sure you tell your doctor what you're taking, because some people can take mega doses of different vitamins that may not be the right course to do. So I am also, whenever you can go natural, and when you can get it in the foods, because there's going to be other things in the foods and the whole foods that are going to help with other things in your body. And like I said, sometimes your skin, hair, nails can be the gateway of your doctor saying, oh, we need to look into X, Y, and Z, because it can be a sign of some other things going on and needs to be checked out. So whenever you can go natural, and be careful with the supplements, because they're not regulated. And I always tell my patients, I said, I don't care what this little pill is, you're not going to get 20 different vegetables and 20 different fruits in that pill that you're taking every day. Why not look at the foods? And, maybe start with that. But yes, so some people do supplements and they can swear by it. And Dr. Bolden can say more about this because biotin over the years has been a very common supplement that people will use over the counter. And I know some of my patients, they like Nutrafol. So I will, I'm going to punt that to Dr. Bolden and let me know
Absolutely. So
what he thinks.
I think you hit the nail on the head when we were talking about nutrition. It's much better to get your vitamins and your minerals through your diet. A lot of hair, skin, and nail vitamins are going to be biotin based. And previously, we used to think that biotin was going to be very helpful for hair. But newer evidence says that biotin specifically does not provide that much benefit for helping hair to grow. It actually can interfere with some blood tests as well. So it can interfere with thyroid function tests. It can interfere with, if you're having a heart attack, sometimes it can falsely elevate those numbers. So biotin may not be as beneficial as previously thought. So getting nutrition through your diet is going to be the best bet. Another one that I think of that's important, iron and vitamin D, specifically in patients that have darker skin colors, they might not be absorbing as much vitamin D from the sun. And so it's important to get that through your diet. Or if you're supplementing something, that would be an important one to look for as well.
You just mentioned something, getting the vitamin D, with that being out in the sun, wouldn't that inflame, if you've already been diagnosed with scarring alopecia, would that inflame more inflammation in the skin, in the top of the cranial area?
Sunlight may cause. Yes and no. So if you're getting sunburn, absolutely. Low levels of light are actually anti-inflammatory. And we can use that for certain treatment options, specifically for non-scarring alopecias, but there's some evidence for scarring alopecias. So think about it. If you ever had a rash, if you ever had psoriasis or eczema, or even acne, and you get a little bit of sunlight may improve that because sunlight is UV radiation. UV radiation is also bad for the skin at high doses, but at low doses, it's anti-inflammatory. So when you have inflammation in your scalp, we sometimes use what's called low-level light therapy or red light that can be anti-inflammatory to help to calm down inflammation and help hair to potentially grow.
Can you expand a little more about that low-level light theory? Because I have started hearing that a lot pertaining to scarring alopecia.
Yeah. So specifically, there's red light therapy, which is almost like a little cap or a little helmet that you put on your scalp. It's done several times a week, usually 2 to 3 times a week. You wear that device for about 20 minutes a day. But what it's doing is causing the light to be anti-inflammatory. And so that's helping to calm down that inflammation on the scalp. It's a safe option for hair loss. It's used for early hair loss because you're not having to take a medicine, you're not having to do injections. It's similar to being exposed to a little bit of light. So not really any side effects from low light therapy.
Dr. Bowler, so what would you say the realistic goal is? Is it to, I guess, stop progression or regrow hair?
It depends on the type of hair loss. The most important thing is to stop hair loss, okay? We're trying to stop progression. The more advanced it is, no matter the type of hair loss, the harder it is to get the hair to grow. And so we're trying to stop it as early as possible. Our medications are much better at preventing hair loss and calming down inflammation than they are at getting hair to regrow. And so early intervention is important because we want to help to preserve what you have. Once you get more advanced, that's when you're having to see Stacy because we're not able to do anything for the scarring alopecia. We're not able to bring back that hair other than having a hair transplant.
Dr. Bowler, I do have one other question. I know with treatment, are there anything on the new horizon for scarring alopecia other than the medication, other than what you've already mentioned?
Yeah. So there's new medications that are being studied, some that are for different types of alopecia that are being studied for CCCA. These are stronger anti-inflammatory medicines that really work on your immune system and decreasing your immune system. There's also some regenerative medicine treatment options. And so that's going to be things like platelet-rich plasma injections, stem cells, and exosomes. Platelet-rich plasma is actually where we draw blood from the patient. We then centrifuge that blood and concentrate the platelets in plasma and discard the red blood cells. We then inject those platelets and plasma back into the scalp to try to help to stimulate the hair to grow. Again, it doesn't work for scarring alopecia, but the theory is if you were to cut yourself just with a knife, your platelets come in to stop the bleeding, but they also release these growth factors which help that wound to heal. So then if we inject those concentrated platelets back into the scalp, the goal is that they're going to release those same growth factors which are going to help the hair to grow. Now, you have to have hair there in order for it to be effective. It doesn't work once it's scarred. There's also exosomes. Exosomes are these little messenger particles that come from stem cells, and these are usually rubbed or microneedled onto the scalp, but they basically do the same thing. They're sending the signal to the hair follicles to try to help to stimulate them to grow. And then for those that have kind of exhausted all their other options, there is hair transplants. This is where you're moving hair from other parts of your scalp into the areas that you have the hair loss. When you have a type of scarring alopecia, you really want to make sure that there's no more inflammation and no more activity if you're going to have a hair transplant. The last thing you want to do is to transplant hair and still have inflammation because then that hair transplant is not going to be effective. But if the alopecia is in remission and there's no active inflammation, then you can undergo a hair transplant.
So hair transplant, if it's in remission, is an option.
It is. But you want to be in remission, and you want to be in remission for usually a couple of years before you consider that.
Dr. Thompson, dealing with hair loss, I'm going to go back. What are the stages of grief that a person may experience?
Well, the first stage is usually denial, just not believing that this is happening, sometimes even avoiding going in for help because we think sometimes if we ignore it, it will go away. Also, just fear of the unknown, not really wanting to hear that we have a diagnosis because we're afraid. So a lot of times we're just in denial. We cannot believe this. We're shocked. Where did this come from? And then oftentimes we're angry because this is happening to me. Why me? What did I do to deserve this? Am I being punished? And then we start to bargain. We say, okay, I'll go and spend all my money just to have my hair back. I'll go and do this, act of kindness if only my hair will grow and stop falling out. And followed by oftentimes the depression stage where we may withdraw from others, we may isolate, we may feel like we're less than worthy, we may avoid our family and friends because we are shamed and we are embarrassed, or maybe even feeling guilty. Uh, and then we also can find ourselves feeling disconnected from our peers because oftentimes going to the salon is a whole experience. It's more than just getting our hair done, it's talking to our peers, it's a fellowship time. So we may feel disconnected from others in our community by not being able to go in any longer and have our hair done. And then also followed by acceptance, just accepting it for what it is. The longer that we deny it, the longer that we may stay in anger about it, the longer that we refuse to accept it, it delays the grief process. So, accepting it is the first step. Realizing that your worth is not attached to your physical appearance is a great step. Going in and realizing that there may not be a cure, but there is treatment. And the more that you educate yourself on the treatment options, the benefits versus the risk, you can rationally think and make an educated decision about what is best for you going forward.
What are some of the effectful, mindful techniques that you use in dealing with anxiety or self consciousness?
Well, with mindfulness, it's being present in this moment. Sometimes it's helpful to find an object in the room, wherever you are. You could be at home, at work, wherever you are, just finding an object that you can focus on. And what it does is that we describe that object in as much detail as we can. What is the texture of it? What does it look like? What is the color of it? Is it shiny? Is it dull? Is it sharp? And what that does is allow us to be present in the moment because the present is a gift. You may find that your thoughts start to drift away about the past and what you could have done, should have done, would have done. And that's where the anxiety lies because we cannot control the past, we cannot change the past. You also may find that your thoughts start to drift away about the future and the unknown and the what ifs. And that's where some anxiety lies because we can't necessarily go forward and control the future. All we can control is right now in this present moment. So we want to focus on our breathing, our meditation, our mindfulness, and realize that we can only control what is here today and allow ourselves to examine those thoughts, reframe the negative thoughts about ourselves into healthier, positive thoughts that we can move forward and handle this rationally.
I like how you stated reframe because when you start looking at a total hair loss and you start changing and accepting, that kind of helped me go back to Dr. Smith about obesity and that image and how to deal with those things. So, Dr. Smith, could you please give us some insight there?
Um, it's layered. It's a lot of layers to peel back. And just like obesity is one of those things that sometimes people don't know. I think it's becoming, people are more likely with the new medicines and everything that are coming out to, you know, address it now with their doctors. But that avoidance, that shame, that blaming themselves and the what ifs and, feeling embarrassed or believing the stigmatizing statements and things you see in media about yourself. So you have multiple layers that are going on. And then, with the alopecia, that's another layer that can hit your self-esteem and your self-image, how you feel about yourself, how you take care of yourself. And just like alopecia, we need to start thinking, it could potentially be something that's reversible the earlier I get in, and this is part of my health. And, there are diseases that can cause the alopecia. And with obesity, obesity is a disease and it's very complex. And the support and, taking that step and feeling safe to take that step to get the support and the evaluation and the treatment and explore those different treatments are so important. But yes, that safe place, and there are a lot of different stigmas. There's a lot of things, a lot of different discriminations that we deal with, and we learn to kind of suppress them in a way, and we cope the best way we can. But any step and taking that first step is so important. And rebuilding, build yourself back up.
Dr. Smith, if you could have every woman focus on like internal health for their well-being, what would that, just one general?
Well, I think first it's important to have a primary care doctor. I may be a little biased, but it's the truth.
No offense, Dr. Boulder. No offense, Dr. Boulder.
You need a partner. You need a partner in your health. And I think a lot of people don't realize the impact of their health and everything that they do in their lives. So if you don't like your PCP, you need to find another one. But you need a PCP as a part of your health. And stay up to date on your physicals and your general screenings, because sometimes you wait until things get to a certain point and you find out that there's something internal, or you have a medical condition or a diagnosis that could have been addressed. It could be diabetes. Diabetes can cause your hair for you to lose hair. Because you're nutritionally, not able to absorb the nutrients and everything that you need. So treatment of your diabetes can sometimes reverse. And like I said, your hair can be the gateway of something that we look into. So if you have someone who's a partner in your health, who knows you and you trust them, and it's a safe place, and you're like, I have this stuff, I have this going on, my hair and whatever. And things you can move forward. And once again, the earlier the better. And sometimes your screening tests, say you had thyroid disease and didn't know it. You've been treated for high blood pressure, and you've been on this medicine, but you never said anything about losing hair afterwards, because timing in that history, once again, is so important. So that's why I say, and that's why it's the truth, and I'm not just biased, it's the truth. You need to have someone, your partner, in your health, someone you trust, and someone that you can go to, just overall with your health.
Okay. How do you see the role of lifestyle medicine in the next decade?
I think the more studies that come out, the more research, and the more that we see, the things that we do in our lifestyle can affect so many different aspects of our lives. So a lot of things are prevented. And we talk about the rising costs of healthcare, of healthcare. It starts, if we want to save money, if we want to do better, we need to educate people, and prevention is important. Early diagnoses are important. Early intervention is important. And people need to understand maybe their habits, how they're living, what they're not doing, or maybe what they are doing is directly related. And so when you hear that lifestyle medicine, there are things that we have known for years. We just have a name for it now that people know about. It's like, oh, this is a lifestyle medicine. Just like you don't want an asthmatic to smoke. Well, your lifestyle is directly affecting your asthma. You need to stop putting smoke in your lungs because your lungs are helping you breathe. And it's triggering you to have an asthma attack. So you need to stop smoking. We know about our lifestyle and development of cancer. Oh, we know that alcohol and smoking leads to different cancers. So that's what we talk about lifestyle. So we're learning more about the importance of nutrition, of exercise, of those whole foods, and prevention of inflammatory conditions. People have the buzzwords now. I have an autoimmune condition that hasn't been diagnosed. I have inflammation in my body. Well, sometimes that's related directly to what we're doing. And so just like lifestyle and culturally based, some of the things that we're doing to our hair and our hair care practices are part of our lifestyle and what we do culturally. And so now that we have more knowledge, we need to do better. We need to do things differently. We need to have that awareness. So oftentimes people, they use their barbershop, their beautician or their barber as their healthcare provider. They go there for advice. I know it, and I can say it because it's in my family. And sometimes they call me and ask me, "Is this? I told this person this or what?" Like you need to stay out your lane. But oftentimes that's where people first go, and they're barbers and beauticians. They know they've had hair loss or they had this and they had that. You need to go see your doctor. Or if they're not doing that, maybe even though the client may say, I want you to do this to my hair, it may be like, this is not the best thing to do for your hair because of this that's happening. And thinking more of, I need a partnership with this person in their health because what they're doing is a part of health. But it just depends. But I've had patients say, my beautician told me to come and take a look at my medications because I'm having whatever going on with my hair. So lifestyle is a whole lot, as you can see, because you got me on the roll.
Very good.
Yes, you are. Eat the rainbow. Eat the rainbow.
Right.
Eat the rainbow.
So, Dr. Thompson, on our last takeaway, on the takeaway of today, what would be your advice?
My advice would be to seek help early, as everyone else has said. Early intervention is key. Partner with your primary care, partner with your specialist, take their advice for referrals. Also with mental health treatment, partnering early will help you to be able to navigate some of the storms that are ahead. And give yourself grace. It's okay to have emotions in response to this because it's a great loss, whether you lose your hair or something else in your life. Allow yourself some grace and some time to process it. There are no time constraints on the grief process, so your journey is yours. Also, set boundaries because people may ask you questions and you may not be ready mentally to answer those questions, and it's okay. Thank you for your concern, but at the same time, I need some time and some space to process this. I'm not taking questions right now. I'm focusing on me. I'm weighing my options, and I'm going to do what is best for me. So just partner with your providers. Make sure you ask questions, and that way you can make an informed decision that is right for you.
Stacey J. Reed, what is your takeaway?
My takeaway is that I stay in my lane. I am not the doctor, and I send my clients when I see something wrong. I send them to a dermatologist.
Dr. Boulder?
I agree with Dr. Thompson. Early treatment saves hair. So if you're having any problems with hair thinning, come in, get evaluated, see your primary care doctor, come see a dermatologist. Come early so we can treat you and get that hair to grow.
Co-host, what is your takeaway for today?
Eat the rainbow. Eat the rainbow. And it's okay. And it's okay to grieve, and that's your personal grief. And as Stacey say, She's going to refer you to the specialist that you need to see, Dr. Bowler, early prevention when you see anything. And Dr. Smith, you know, we're going to eat the rainbow.
I am Mary Jeter. I am the host of 50 and Unfiltered and the founder of Chat You Do Women Group. It is very important to reach me, and you can reach me at 601-720-6437 or at the website, which is spelled out, 50andunfiltered.com. You can go there and get more information about alopecia also.
If you can't get Mary, I'm just her right side here, Harriet Carter, and I'm at Harriet, HARRIET, .carter2013 @gmail.com. 601-940-4185.
I am Stacy J. Reed, and my number is 769-234-1513. Or you can schedule a consultation at www.stacyjreed.as.me.
And I'm Dr. Deidre Thompson. My clinic is Graceful Wellness. It's in Flowood, Mississippi. You can book online at www.mygracefulwellness.org or by calling 601-953-1504.
I'm Dr. Patrick Bowler with Magnolia Dermatology in Jackson, Mississippi. We're located off of Lakeland Drive. You can schedule an appointment by calling 601-910-3004 or by going online at magnoliaderm.org.
And I'm Dr. Lori Smith with Beacon Internal and Obesity Medicine in Concord, North Carolina. My website is www.biome-medical.com. So if there's anyone who was in and listening on North Carolina, I do not have a Mississippi license, okay? I used to have one, but I don't have anyone anymore.
Today, I want to thank everyone for joining us. I want to thank the panelists. They have been wonderful. My co-host is wonderful. And look, take care of yourself, get early diagnosed, and you're not alone. You will be able to get more information if you go out there and you sign up and subscribe to 50 and Unfiltered. I will be releasing this on YouTube and also on the website. Again, thank you for joining us and have a great day.